So welcome everybody. Always fun with technology. Welcome to our virtual conference, and I'm excited to really be here. The purpose of my presentation today is to really spend some time with you and talking about going out on a limb. And it's an in-home exercise program, and it's very, very general for us. I want to share with you my thoughts and ideas as a physical therapist and what it is like for me as a PT, even during virtual times working with clients. In the past, I've had the privilege of being able to run a gait analysis clinic with the Amputee Coalition. And during that clinic, I'll share a little bit more about it. We've had opportunity to work directly and hands-on. So the real focus of what I'm trying to do with this session is to help us really to start really thinking about the importance of staying physically active. We're trying to get to a place where we're helping people walk well. And, you know, these are challenging times with COVID, aren't they? We're not able to really experience the ability to walk well in times where we're challenged. One of the reasons that I wanted to have this discussion is because I've actually worked with some of my clients who have told me they've stopped even wearing their prosthetic because they're not getting out, they're not socializing as much. And that can be a challenge because there are difficulties we see in walking, and that as walking is something here when one is a prosthesis user, you need to keep active, and these are hard things to do in these times. So I'd like to be able to share some of the common things that we see or what we've seen in our gait clinic, and then I'd like to encourage you to try maybe a few basic exercises at home, because in general, people with limb loss, we focus on aerobic conditioning, balance and strength, standing and walking activity, so you can keep your heart, your joints, and your muscles healthy. And that's the general theme of every patient I've ever worked with. That's the kind of information, that's the kind of stuff that I want to do all the time. So the other issue that we need to deal with here as we start to focus is that I want to remind you, as this will come up, that we want to do things that you feel safe with. And so it's important that when we think about the safety that we're doing here, that I'm going to show in a second a little disclaimer. And that disclaimer here is that saying that by attending this session, you're going to agree to some risks. And I want you to understand that please don't attempt to do anything here that you see on this video if you've not been cleared by a doctor for exercise, if you had recent changes in your ability to participate in exercise. So if you're not really sure, you're welcome to follow along. You're welcome to follow along and do what you think you can, but please be very cautious. I want us to understand that really as physical therapists, our job is to do a full and thorough examination before we give you any exercise that is really specific to you. So that's the important point that we want to make sure that we carry on with and we think about as we're going through. So our cautions here before you exercise, we have our happy heart who then gets very tired. Please think about things here. Anytime you think about exercising, the real scary stuff is that you don't want to do exercise if you haven't been cleared by a doctor. If you are in active conditions of pain or discomfort, fractures or inflammation, not a good idea. Of course, balance and high risk for falls. As somebody in the limb loss community, we know that falls are a high risk. And so we want to be careful that you're not doing anything that places you any of those things. Also thinking about, as a cautionary statement, if you're feeling uncomfortable, that's okay, and you may try certain things, but again, be careful and cautious about what you do. So these are the kind of things that we wanted to deal with a little bit when we're talking about what we are to do today. So as we think about the cautions that we're taking, the first thing that we do in a gait clinic, or the first thing I do in a physical therapist is start to explore with each person, what is it that your goals are for walking? What is it that you want to accomplish? How is it that you want to accomplish those things? To help you discover really what is a very realistic goal. And so, you know, we have to think about that, is that what is it that we need to know about you that's going to help us share how we can get you to the optimal level of walking ability. So there are some things I'd like to talk about first in normal walking, in typical walking, what we see and what we expect to see in our everyday walking. that can really be something for us that can cause a certain amount of issue with how we walk in general. So one thing that happens is, as a physical therapist, I have to tell you that we have some disadvantage to a degree, or an advantage, is that, first of all sorts of things affect our walking. You know, we walk in ways when we're sad or mad or happy, and these are the kinds of different walking patterns that we normally have. So the challenge for us, what we're trying to figure out is how, when we didn't know your walking pattern before, let's talk about walking patterns too. People have a swagger. Some people have a giddy up in their gait. So there are different things that we have in our own walking patterns that kind of are important to us. And so now we add a prosthetic limb, and it's very challenging to wonder for ourselves, wow, how do we fix that walk? What is an ideal walk for somebody who has a prosthetic limb? How can we make that happen? And we have to recognize too that our walking skills change throughout the lifespan, that walking when we're young in life is a little bit different than the walking that we have when we're older in life. And so we need to recognize that it's not always the same thing when we're talking about how we want to adapt that walking. I certainly hope we don't have to worry about the kind of walking we see as we get old with a cane, but these are things that we do need to think about. So what do we know about walking without and even with the prosthetic? In order for us to be efficient in our walking, it's dependent on a number of things. First and foremost, we have to be able to take weight on the body of each leg. That ability to balance on each leg is also essential. We have to have a period when we walk where we're only on one leg to allow the other to progress. And that ability to balance on a single leg, especially in a prosthetic, is extremely challenging, especially the higher up that one goes. So it is hard for someone who's lost just their ankle. It becomes harder as we go through the knee, and even harder as we go up the chain of the body, losing things even as high up as the transpelvic or hemipelvectomy. We also have to be able to move each limb forward and take a nice sound step, and that comes from that ability to balance on one side. Can we take a big enough step? That's going to be really important to us. And so we also have to be able to adapt to other environments. How do we walk on different environments so that we can remain efficient? How do we do that to stay healthy, efficient, and what's the easiest way to do that? So what we find here is that when we walk, it's important for me to point out a few things, and some of this is a little technical, but I'm hoping that we'll be able to share this. So what we see on the left is a graph, and it's showing us this up and down curve. It's showing us the up and down cycles of how people are walking. And it's teaching us that that up and down, that our body is efficient, believe it or not, by sort of going up and down a hill. And that going up and down the hill is a natural thing. Sometimes we walk on our toes and we go too high up the hill, and that consumes energy. So that's the kind of thing that would be a challenge, because we do not want to have that much energy wasted. We also should move side to side. That side to side movement is crucial, again, for us in such a way that as we move side to side, we are certainly able then to balance from limb to limb, keep our body over our support base, and that's fantastic because we're able then to balance ourselves and keep our trunk in the middle. What you're seeing here in the data is that even in good walking, even at good walking, there is much greater effort, and the higher up we go, the energy consumption is different. The sway is our way, again, to gain and to lose energy, to help us gain energy and lose it so we stay efficient. And that means cardiovascularly with our heart. And you can see that depending even on the cause of your amputation, whether it was trauma, which it may have been, it could be trauma, but if it is also something different, where you've had a vascular disease and already are challenged a little bit with some of your heart perspectives, that we can see that you work much harder for every given speed of walking. This is the answer to why many of you, as we've lose muscles and you've lost part of your joints and muscles, recognize how much harder it is to work when you have to wear a prosthetic limb. It's exhausting. And so that is something why it's so important that we do a lot of aerobic conditioning. that's the relevance and importance for us to want to be able to train on all those factors. So when we look at the things that we think about in our walking, when we're considering all of those factors that we want to do to remain efficient, to balance, maintain good strength, these are the kind of things that is unique to each individual. I've worked with some folks, for example, who have really been able to have very good balance. Even when they have a high level amputation, they might have very good strength. But the issue for them is that they have vascular issues that are very, very challenging. And those vascular issues can create some problems that are very challenging to the person from the level of having good heart function. I've worked with others that are cardiovascularly in very, very good shape, but have had some trauma to the limb and have really serious strength issues and pain and discomfort. So once again, this is the reason why every year at the national conference, I have been privileged to bring a team of physical therapists, people that work very regularly with people with limb loss, to meet you, to assess you through a video assessment. We have the opportunity to watch you walk. We go over that walking with you and your family members or people that are there involved with you and are part of your life for helping your care. And then we spend about 30 to 45 minutes of doing actual treatment for clients. And we do that treatment through physical therapy. And you can see to the right here on this photo that there are sometimes we're working on stretching. We may be working on some aerobic balancing. And in the back, you can see that we're actually working here with somebody on some balance activities and some standing and weight shifting tasks. So that's really the goal of what we're doing in this clinic. And I'd like to bring together some of that here for you to give you some ideas about what we may be able to do or what you may be able to do at home and see if this is something that you could try. So when we think about our examination in physical therapy, we have to begin with the focus of what we're trying to look for in multiple patterns to see if that walking looks symmetrical, even, what we're looking for. This is Ken. He is an above-knee amputee who lost his limb through trauma, and he is somebody that he and I have worked together many, many times, and he is a very good ambulator. He's got very, very good skills for a person with limb loss above the knee. We can see in his walking, we're going to look at his step width. How far apart are his feet? One of the things that we look for is to see that his feet are narrow in its walking process. Does he actually keep his feet relatively close together? That's a good sign when he keeps his feet close together, because as we see that happening with his feet close together, it tells us that we're being able to maintain his body over the base of support. I don't have a view of him for the side right now, but if you watch him carefully, we'll see that he's able to take nice, even steps, and that those steps together are even so that he's able to shift enough weight onto his prosthetic side and his sound limb side that he can actually show that he can take nice, uniform, even steps. And that's helpful. The other thing that we'll get to see is that we want to look for, can the person get on the ball of the foot, whether that is an above knee amputee or someone who has lost their leg below the knee, because getting on the ball of that foot helps set the knee up for doing something important, which is bending. And that is something that we want to make sure that the leg is doing. So what I'm showing here in this video is that I'm trying to show here he is on the ball of his foot. He has taken a very nice step onto his sound limb side, and that's helping him use good balance. The other things that we look for when we're looking at walking is we start to look at, is the pelvis moving, and how is the pelvis moving? And of course, how are the shoulders rotating and moving? So those issues of what we look for are important. And when we've watched him walk for a while and we get the chance to see him moving in space, we're going to look at all these qualities to see, is he able to keep his pelvis and trunk in alignment? Now, one thing I will tell you here, Ken works really hard at this. And the issue is that you can see when he turns, the trunk lean, which is what we're going to look at in a minute, is not an unusual feature that we see in people, and that can be part of a challenge. So we see he's rotating nicely with his pelvis. We can also see here that he's starting to rotate his shoulders, but he does have a slight lean. And we'll talk about that in a minute. It is the most common thing that we see for the people, for a person with above the knee amputation. We've lost an important muscle. And the muscle that we've lost is really on the outer thigh. It's been shortened. Now here's Ken getting to sport his type of walk when, again, at this point, as he's walking, he's really demonstrating a lean when he didn't have good control. He had this early on. Many times, if this is the case, as you can imagine when walking like this, how much back pain there's going to be, how many challenges there are going to be in muscle loss on one side. The side he's leaning on is getting constantly compressed. The thigh muscle on the outer part of his thigh normally would attach to below where the knee unit is right now. By shortening that, any of us have understood what a crowbar is. You've sort of shortened one of the key muscles that acts sort of as that lever to help hold your trunk and pelvis up in space. As you can imagine, continually walking like this can be extremely painful. It can be uncomfortable. We have a wide base of support. We don't have even steps. We see lateral movement of the trunk. The pelvis and trunk are not complementing each other, rotating in a nice manner. And all of those things are factors that significantly affect the way and quality of how he's going to walk. So again, he's a good walker, but again, this is the kind of thing that we would see and that we would look for that would tell us that we have some issues. Next, one of the more common things that we see in someone who is a transtibial amputee is this is Rex. Rex lost his leg below the knee. He had a very, very remarkable history. He lost his limbs through a very severe heart attack that put him into critical care. He had a lot of procedures done, and in addition to losing his leg below the knee, Rex also lost toes on the right side, so he had some difficulty balancing on both limbs. Many of you who might be bilateral can relate to that, or you've had loss on both sides. Balance is significantly challenged, and he even lost some fingers on one hand. So when we look at these things early on as a transtibial, some of the things for transferring weight, let's focus now on what we see here for the transtibial below knee amputation. What we're seeing here is that he's had a very, very straight locked knee. And that locked knee means he's not really being able to progress the other limb forward. We see this commonly in people, for example, when they are struggling, not just they're locking their knee for reasons. They might not have the quadricep strength. Now, he could have hip strength weakness, but really we're looking at the quadriceps being weak, the muscle in front of the thigh, and so he's not really going to walk and let that knee bend. He's afraid to let it bend. The other thing that we're going to see when we watch these videos that we might see is that he's also going way up onto his toe on the other side. So that curve we were talking about of going up and down the curve is more excessive than it needs to be. The problem with that, of course, as he's going up and down that hill much more than necessary, is that you're going to really watch him be energy inefficient. He's going to work harder because every step of the way he's going up and down the hill. So these are the more typical things we see, and I wanted to keep it relatively basic so I can hopefully get back on and see if I can address some of your questions. But once again, to think about this, what exercises do we want to see you maybe try at home, or to consult with someone, again, with the disclaimer, please consult with someone to do these things. There are exercises of aerobic conditioning. You can do strength training, core training. We're going to leave some of the core training till later, since we know that that's going to come up in another talk. There's balance activities and simply just practicing walking. These are the kind of things that we take for granted. Anyone with a leg injury needs to remind themselves, and prosthetic walking is not a typical pattern that we've learned in our brain. So even just practicing walking, practicing different ways of walking helps. So let's take a look at the aerobic conditioning part. As we look through heart healthy activity, in a time where you can't do much, I've given both of these clients soup cans. I've already told you a little bit about Rex, so he's performing a little bit of the higher level, and this is Debbie. Debbie also lost her limb as a result of vascular disease. She had a rare blood disorder that related in this condition, and she ended up losing her limb above the knee. She is about 6 years post, and she's a little bit older, and she looks nice and young and healthy. I'm not going to reveal her age, but she is retired and at an age where she really wants to stay conditioned. And obviously, by being less able right now, she's losing that conditioning. So as you really watch these guys, one exercise I like to do is just uppercuts. It's something you can do in sitting and or standing. It is not a hard activity that you can do. It is something that you want to watch your heart rate for. But believe it or not, if you really get into this and really punch like you mean it, sometimes there's a few things that come out of it. First of all, it gets some aggression out. It's healthy to do this. Don't punch anybody, just punch something. It's healthy and it feels good to do some of this. And believe it or not, even after doing 1 minute, resting for 30 seconds or more, another minute, resting, and then another, is fatiguing if you pick the right weight to use. On the floor, besides Debbie, there was a 1 pound weight, but I switched to the soup can just to demonstrate that this can be done at home. These are valuable things that you can do at home. And again, if you need to stand up and do it, it also helps you shift your weight. So if you are a transfemoral amputee and are not safe transferring your weight, then I would recommend doing this in a sitting manner. That's an important fact that we would want you to do. So the other thing then is, again, starting out, I like to do a little bit of aerobic conditioning before stretching. It's kind of like warming up the muscles. Some people like to stretch first. So if you're not doing the punching real aggressively, the goal of that is to start warming up your muscles. And that's something to do to warm up your muscles. Many of you have seen some of the stuff here with the picture on the right, where what you're actually doing is doing arm circles. You're doing some arm circles that warms up your shoulder, or do even some shoulder shrugs. Get some shoulder shrugs going so that you can move your arms a little bit, and that would be something that you're working on. And also, again, as we think about these things, are you stretching your legs? And some of these examples show you concepts of that you can do stretching while you're sitting and others standing. So stretching your low back by leaning forward, leaning back and stretching your back, side to side, get those tight muscles there. If you happen to have trunk leaning or issues like that, going side to side and just relaxing your muscles are a fantastic thing to do to get yourself feeling more flexible, and really, really important. The other things that we can do after we do some stretching is to move on to doing some strengthening activities. And our strengthening activities are important to us in such a way that we can begin with the core. And as I said, please stay tuned. Dr. Daniel Lee and I will be present for this, is doing something on core stabilization during COVID. So I won't spend a lot of time here. I just simply want to tell us that there are ways you can actually do sit-ups easily in a chair, from a chair. You can see leaning back, you're working the upper abdominals, as you can see in the top. You can do twisting ones by leaning back in a chair. The further away from the back of the chair you sit, the harder it will be to touch the back of the chair, and then you sit back up. You can lean then on the chair and bring your legs towards your chest. That's getting all the muscles active. The other thing that you can do, and let's be honest, right now, and for many of us, is just simply getting up and off the couch, literally and figuratively. Even as a transfemoral amputee, you can watch Debbie here. She's showing us that she is really doing an effective job of being able, I would like her to shift her weight more onto that prosthetic side, but she's trying to use that to help. She's thinking about her gluteal muscles, her quads are working, she's active, and this is really something that she can do. And what I've recommended for her to be doing this is that to try and do at least 5 times of every commercial. You'd be surprised how many times the sit to stand activity is highly related to how many times we can do sit to stand is related to fall activity. And that, in fact, we're looking now more that people can get off the floor, have a lower risk of some issues, because we're using strong muscles that are telling us that we are able to therefore benefit from having us move in a way that we're getting the large muscles like the gluteal muscles and the quadricep muscles strengthened. So this is a great activity. Also, at a kitchen countertop, do something to strengthen the thigh. Again, for the transfemoral or transtibial amputee, if you have hip weakness, lifting the limb that is involved is easier. Why? That's simply because all you're lifting is the weight of the limb. We can see that Debbie is standing up relatively nicely in this picture. She's got her mass standing up over her leg very well. So she's actually being able to keep a nice posture here a little bit better. In fact, she's probably lifting a little too high on that top picture. As we go down to the bottom, it's much harder. She's actually now using and putting all of her weight onto the prosthetic limb. And by doing that, she's actually trying to facilitate or make those muscles in her gluteal region work. and including the crowbar muscle called it's called the TFL. It's a very long muscle, and it is something that it is a band that's attached to a muscle, and it's important to hold our trunk upright. So you can see she's leaning a little bit over to the side, telling you that some of those muscles are not really effective in holding her up. So she needs two hands on. Other people get better and can use one hand, but two hands would be highly encouraged until one can stand up straight. As we move on and we think about how then do we strengthen the gluteals but also really get the quads involved, especially for the transtibial amputee, the person here with limb loss below that knee, we're looking at Rex, and he's just demonstrating here how he's doing squats. And how many of us remember doing squats and push-ups and all sorts of basic activities? You know, some of those things we learned when we were much younger have benefit. You know, a regular push-up, doing something like a squat when it's safe. Sometimes I recommend people do this with a chair. Another way to strengthen the quads that don't involve such a deep lower squat as we're seeing here with Rex, which can be very, very challenging to do, is that you can start by placing a chair or a counter or something in front of you and place your limb that you would like to strengthen. So the prosthetic limb goes up on a small book, and you try and step up. Notice that with Rex, with two hands on here, as he goes to step up, as you see him going higher and higher, the nice thing that we see here in this presentation is he's keeping his back straight, his posture looks really, really good. If you have to lean forward to do this activity, it means the muscle is weak and you're probably not getting the benefit of it. So that means that you may have to hold on to something else or just simply practice bending your leg a little bit and trying something else. We then move on to some of the balance activities that we have, and what we're trying to do here is weight shifting. So with weight shifting, as we start to get better with some of the other basic strengthening activities, now we want to put that strength in action. And that's really the next step that we want to see people doing, is we would like to have people go and move into the next action and try and do things. So what we see here is Debbie is using two chairs to do this, and clearly Rex is doing this at a very, very high level by putting a pillow under his leg, using only one hand. And as you watch Debbie here shifting her weight, she tries to use one hand, and then we get a funny whoa response at one point. And I know that might be hard to see, but it does make me laugh a little that we got to see a whoa response. And that was something that she realized that, wow, maybe I went a little too far. So once again, my suggestion to her would be, please keep two hands on as you practice this and just learn to take that weight on the prosthetic side. And again, for Rex, it's more of a challenge. He can do things without the pillow, with a single chair, and then continue to move his way up. So I think the point that I want to make here is that we have to get out and do. We have to make sure that we're moving our body to the best of its ability so that we can achieve high-level walking, and that we do that and help you as physical therapists by following some basic philosophy of trying to encourage the types of exercise that help make walking stronger. What we're really going to see here in all three of these videos as they move along is that these are good ambulators. These are people that have worked really hard and done their homework. I'd like to share just a minute to talk to you a little bit about Claudio. Claudio is a person who lost his leg at the age of 16. He's not 16 here, but he lost his leg through osteosarcoma, and he has lost his leg all the way through the pelvis, transpelvic or hemipelvectomy. He did not walk for a long time because he felt crutches were easier for him. And then he decided, because he needed some shoulder surgery, that he wanted to get a prosthetic again so he could walk. And that was an important thing for him. He did not want to use a wheelchair. He wanted to walk. This is about 1.5 years after he got that socket. Now, he was walking quite well in the very beginning because he was in exceptional shape. So here's a man who had very, very good muscle control, core control, balance on his sound limb side. He played crutch soccer. He hiked with his crutches. So he really had a lot of things that he was able to utilize to help advantage. But again, you look at his gait. Yes, he has a little bit of a wide base. That's normal. That's expected. He sinks a little on that side and leans. but he has been able to move his pelvis well and his shoulders by getting good, strong integrity and muscle use. So I don't expect that this is something any of us can do and achieve in a single session. It takes a lot of time and hard work, and many of you know that walking is not easy when you're first learning. And the challenges also depend on how did you acquire that amputation? What happened, and what other things are important for us in therapy or medicine to address, because it's much more than just the walking part. We have to treat the whole person. We're trying to treat all of the issues you bring to us. Are you struggling with heart disease? Do you have diabetes? Do you have other medical disorders that need to have monitoring and careful care? And this is why it's important to recognize that no matter what we're doing with working out, we want to make sure that we're well aware that our physicians clearly know what is going to make our best way to walk and to be out in the community and get things done that we want to do. So I'd like to summarize here with the last bit where, as we're watching people walk, I think that we really need to understand that there are many other things that you can do. Some are safe at home. And really what I found is that my experience in working with people with limb loss is you have to sort of make walking an exercise at first. If any of you have ever driven a standard shift car, and I certainly don't mean that as the same as losing a limb, but in the beginning, it's very hard to shift the gears and drive the clutch and think about all the things without the car stalling and going out. Your prosthesis is something foreign in the beginning. It takes time to adjust. I'm not a person with limb loss. I'm not an amputee. But in my 36 years of working with people, I've listened and I hear and I recognize scientifically that it takes time for the brain to learn a new way to walk. So like anything else, practice makes perfect and practice makes better, even if it's not perfect. So whether you use a walker, a cane, you don't use any device, just get up and go. Be safe. Be safe when you do it. Try walking forwards and backwards. Hold on to a countertop. Do a little sidestepping. Practice walking in different patterns that allow you to actually be what you want to do, that allow you to actually go ahead and feel good about being able to do things that you can do that make you comfortable. And that's the important thing that I'd like to share the most with you today, is to do that. So what I'm going to do here is I'm going to end the PowerPoint for a minute, and I'm going to go back and start seeing if people have questions for me, if I can respond to some of those and take some time to be able to do that. So I'm going to look at some of the summary here and see if we have some questions that we can think so. Andrea, any questions that I can feel that you can see for me? Let me go onto this page and see if I can see it through the live chat.
For short AK residual limb, and then one from
We're just working through some of this challenge here to see if I can get on.
Bilateral AKA.
Yes, I'm sorry. Can you say again? So let's see. We have one here from Elizabeth. Any tips for someone with short AK residual limb would be really appreciated. Yes, when you have a shorter limb, so that we're aware, it is quite a challenge that it does make it a little bit more difficult to be able to get your weight over onto that limb. I would highly encourage you to always use two hands. You may start with some exercises that strengthen your gluteal muscles even when you're laying down and doing some things like that. So it may be something that would be possible for you to be able to do with some help. If you have a shorter limb, work with your prosthetist as well, and also to see if they can refer you to some physical therapy so you can get some really more beneficial targeted exercises to strengthen what you're doing. It is not unusual to see more of a lean with somebody who has a short limb. And that's okay. And sometimes we have to understand that walking has a certain way of walking, and there's only, and we have to be comfortable with that. If it affects your balance, using a cane is also very, very helpful to counterbalance that until you get strong enough, or keeping one if you feel like that leaning or that short limb is affecting you from having too much pain. But I would highly recommend then you seek some care and see if that helps. Any other questions that we see? All right, well, without any other questions, thank you so very much. I'd like to thank the Amputee Coalition for this opportunity, and I wish all of you the very best. Take good care.